I am I am a third year student of Mechatronics Engineering Department at Russia University of Engineering and Technology. Today, I am going to present our research paper titled Real-Time Patient Monitoring System to Reduce Medical Error with the Help of Database System. So here is my presentation outline. Now I will proceed to the introduction section. After my presentation, I will take any question you may have regarding our approach. So what does the term medical error mean? A medical error is an unintended or avoidable situation that happens during medical care and causes harm or injury to the patient. Nearly 250,000 people die each year as a direct result of medical error in US hospitals, making it the third highest cause of mortality in that country. So think about the situation in our country. I was inspired to work on this project after a friend of mine died due to medical error. It was both heartbreaking and eye-opening experience for me that made me realize the importance of addressing this issue. So, one of the main issues of medical error is the lack of complete and accurate information about the patient. So, our goal is to make sure the doctor have timely, accurate, and complete information about the patient. So, to that end, we propose a real-time patient monitoring system equipped with continuous data acquisition, storage, real-time output in a built-in system, an alert system, and long-term data visualization. Here is a patient monitoring system that is used in real life. So our objective is to develop a patient monitoring system and to develop an effective device that will that ensure the doctor have access to timely and accurate information about the patient. So let's see the literature review. Here are some literature that we reviewed in the process. In a study, Amos Uddin and others developed a device that collects data from various sensors and a mobile application is used. But their device does not have any data storage architecture and neither they have any long-term visualization or any kind of alert system. In another study, Kumar and others developed a device that collects data and store in a website. That website is accessible to all, which poses a data security risk. And additionally, it doesn't have any kind of visualization or alerting system. In a separate study, Marathi and others developed a device that stores data in NodeMCU cloud, which maintains data security, but the doctors need to manually check the data because their device lacks any kind of visualization technology. Our proposed device in our paper addresses all of these limitations. So now let's see our proposed methodology. This is the block diagram of our methodology. It has three sections: data receiving or the input section, processing, data sending or the output section. In the data receiving section, we have 5 different sensors. We chose these 5 sensors based on the availability and cost of the sensor, technical feasibility, and most importantly, we consulted a doctor about the most important and widely used parameter in clinical settings. And as a processor, we have an Arduino Uno, and for the visual output part, we have an LCD to show the data in real time, an alert system that sends an alert to the corresponding doctor and nurse if the measurement go above or below the recommended range. We have an Wi-Fi module that collects the data and sends the data to our server. That server then used as a source file for our visualization. We will present our visualization later. Now, this is the hardware setup for our proposed system. This tableau represents our data storing format. We have the date, time, and the corresponding measurement. We have the blood temperature, heart rate, blood oxygen level, room temperature, and room humidity. It may seem that room temperature and room humidity does not have any effect on the patient, but actually, many patients are very sensitive to this situation, to these parameters. And above all, the hospital situation in our country is really bad. So now let's go to the results section. So this is the real-time output we can see in the LCD monitor, and this is the output for our alert system, and this is the header part of our final visualization. From here, we can select a specific date or date range, and all the other graphs in the visualization will change according to this date range. And from here, we can see the total number of records. And from this section, we can see the total number of available data for a specific patient in the entire database. This will help the doctor to quickly access the data, and it will save a lot of time. Now, this is the chart for body temperature, and this is the chart for oxygen saturation. We also implemented a gauge chart, which will indicate the critical range and the normal range. Here is the chart for pulse rate, and here is the chart for room temperature and humidity. For all of these charts, in the x-axis we have the time, and in the y-axis we have the corresponding values. And this is the chart for ECG data, and we also implemented pivot table to easily compare different measurements in different time and dates. Now, recently we participated in a competition, and our project came as a second runner-up, and now we are trying to turn our project into a product. We have the funding, and we are trying to do that. And here is the certificate from that event. Now, let's see how we can improve our system in future. New sensor and functionality can be used. Our system is an end-to-end framework. We can easily add new sensors with just few lines of code. And machine learning can be added to infer patient situation. So why does inferencing is important? People without medical background doesn't know much about this parameter. So machine learning can help, giving them a complete overview about the patient situation. Now we are using our data server as Google Sheet. We can implement a dedicated server and store all kinds of medical records like prescription, test report, etc. Now let's head over to the conclusion section. Invention doesn't have to be fancy. It has to be effective. Our device is an effective solution that addresses a significant problem in healthcare, medical error due to information gap. This project leverages innovative technology like sensor and data analytics. This approach differentiates from traditional methods by providing more complete and timely information and addressing issues such as hospital environment quality. We have the resources and capabilities to develop, implement, and sustain it over time. Here are the references that I mentioned in my presentation slide. So thank you all, and now I will take any question if you might have regarding our approach.